Welcome back. If you're interested in weight loss surgery, here is the man with all the answers. Please welcome back bariatric surgeon, Dr. Joseph Chebli. We are so glad to have you back. He is the medical director for the bariatric surgery program at Venice Regional Bayfront Health. And today you brought with us David, a man who has had bariatric surgery. What is that?
Bariatric surgery is otherwise more commonly known as weight loss surgery, but we like to think more about the effects of the operations on the hormones that happen even before people lose weight and the improvement in their diseases like diabetes and high blood pressure. And so we like to use the term nowadays metabolic surgery to reflect that benefit for our patients.
So the real thing is not that you're cutting off his stomach and making it smaller, it's that you're affecting the hormones and those things that make you overeat.
That's exactly right. Absolutely.
That's very
you're
impressive.
A great student.
I'm really interested in this. What was David like when you first met him?
So David is a retired policeman from Venice, and he is the Dean of Students for the Student Leadership Academy of Venice. And he was a poorly controlled type 2 diabetic on insulin on 6 different medications for diabetes, 6.
Wow.
And then had high blood pressure and sleep apnea and elevated cholesterol and fatty liver disease and osteoarthritis and had joint replacements already. So he was about 100 pounds over his ideal body weight when I met him. And I'll let you tell, he'll
So here was a man in trouble.
Yeah, no question about it.
He probably didn't look very good either.
Well, we just
Bring
saw
him
that.
out.
Well, I would not say that to
handsome.
I would not say that to a retired police
Yeah,
officer.
look, that jacket's a little large, David.
It is.
Tell us about the jacket.
This was one of my favorite coats before I had surgery, and obviously I don't wear it anymore.
Wow. Take it off and let's see what you look like now.
You look
Very
amazing.
handsome.
How much weight did you lose?
114 pounds.
Congratulations. That's my whole body. No, that is. I weigh 114.
How did it change the way you felt before
Oh,
and
I have
after?
so much more energy now. And I was moving some salt, 2 40-pound bags of salt from my pickup, and I was carrying them after I'd lost the weight, and I realized I was carrying more weight than this every day, everywhere I went.
Oh, wow.
So it kind of dawns on you at that point.
No, weren't you wearing on your joints? Like, that's one of the reasons you had those replacements?
Absolutely.
So the surgery, what was that like? When were you back on your feet and ready to go for regular activity?
I had the surgery on a Wednesday morning. I was out of the hospital on Friday, and I led music in a church song service Sunday morning and Sunday evening, which was a little ambitious after the fact. But with the laparoscopic surgery, it's a very fast recovery.
Oh, that is wonderful. And
How
I
do you
understand
feel?
you can do things you weren't able to do in the
absolutely.
past. What are some of the things? Look at this.
Oh,
there you are.
thank you.
Very handsome.
Oh, great picture.
That's an after picture.
Where
Yes.
was this? Were you on a cruise?
On a cruise, yeah.
Oh.
So you're going places that you didn't go before.
Oh, absolutely. And doing much. I have a couple granddaughters that were in Tampa, now are in Atlanta area, and I want to be around for them. Watch them
And
grow up.
traveling was probably much more difficult when you were heavier. So to go on a cruise, there would have been probably a little anxiety about going, right?
Cruises, especially airplanes, are you going to
Yes.
fit in the seat? You know, do you have to ask for a seatbelt extension? You know, all those things are definitely stressful.
Do you have any after effects from the surgery?
Well, I had a friend that had a restaurant, and he'd come by, and I'd only eaten a little bit of my dinner, and he'd say, "You don't like it?" I said, "It's great." I said, "I just can't eat that much anymore."
And that's
So,
okay, because you were
absolutely.
probably eating more than you needed to,
Way
as
more.
many of us do.
And it's not a problem for you anymore.
No.
I think that's the best part of all, that horrible desire to overeat goes away. And the weight, because you look wonderful.
I know, like, when people get to that point where they say they want surgery, there's probably like a back and forth. So what made you make that final decision to say, you know what, I'm going to do this?
My wife had had weight loss surgery in Atlanta about 8 years ago, and I was wrestling with driving up there for pre-op and back and forth for all the visits, and I met a man, again, from my church that I hadn't seen in a while, and I said, "You look great." He said, "Well, I had weight loss surgery." I said, "Where?" He said, "Here in Venice." I said, "You're kidding." And he told me about Dr. Chebli, and that was kind of the push that I needed to get with the program.
Wow, you look great, though. You really do.
Yes, we are very proud of you. Events coming up. You've got a lot of things happening.
We have a phone bank here at ABC 7 this coming Monday at 5 p.m. And then we have 2 events in Sarasota. One at the Hampton Inn in Cattleman Bee Ridge on the 12th, and then Hotel Indigo on the 19th. Yeah.
So you can ask your questions, and for more information, you can go to veniceregional.com/weight loss, and we'll be right back and find out who's been visiting the Caragiulos in their kitchen.